So, good evening, Doc Tina. So, I'm going to report about the teratogenic effects of isotretinoin. Next slide, please. So, for the topic outline, we're going to discuss what is a teratogen, common usage of isotretinoin, the teratogenic effects of isotretinoin, treatments and interventions for patients that are exposed to isotretinoin. Next slide, please. So, what is a teratogen? So, according to Malden, a teratogen is something that can cause birth defects or abnormalities in a developing embryo or fetus upon exposure. So, teratogens include some medications, recreational drugs, tobacco products, chemicals, alcohol, certain infections, and in some cases, health problems such as uncontrolled diabetes in pregnant people. So, next slide, please. So what is isotretinoin? So isotretinoin or 13-cis-retinoic acid is an oral derivative of vitamin A that is used in the treatment of numerous dermatologic diseases such as ichthyosis, hidradenitis suppurative, rosacea, non-melanoma skin cancer prophylaxis, but mainly used in sebaceous gland pathology. So the liver naturally makes small quantities of isotretinoin from vitamin A, but the drug that is prescribed is made synthetically. So isotretinoin can cause several side effects, but by far the most important is teratogenicity. So next slide, please. So here is the chemical structure of isotretinoin. So for the common usage of isotretinoin, isotretinoin is considered to be the most efficient drug indicated for the treatment of severe forms of acne vulgaris and mainly due to its strong sebum suppressive effect. So, which is induced primarily from sebocyte apoptosis. So, the apoptosis effect generated by isotretinoin is also the basis for its use in the treatment of childhood neuroblastoma, promyelocytic leukemia, or basal cell carcinoma. It also induces apoptosis in adult T cells, leukemia cells, B16F10 melanoma cells, primary human keratinocytes, or Dalton lymphoma aside cells. So as a result of all this biologic mechanism, it has been established at a dose of 0.5 to 1.0 mg per kilogram per day for a period of 4 to 6 months is enough to produce a reduction in sebum excretion by 90% within a period of 6 weeks. Next slide. So for the teratogenic effect, the risk of teratogenicity in infants exposed to isotretinoin in utero is estimated to be 20 to 35%. This includes numerous congenital defects, including craniofacial defects, cardiovascular and neurologic malformation, or thymic disorders. Along with this, neurocognitive impairments, even in the absence of any physical defects, has been established to be around 30 to 60 in children exposed to isotretinoin during prenatal period. So scientists have conducted studies showing the severe teratogenic effects since isotretinoin was introduced on the market, both in laboratory animals and humans. So in humans, malformation induced by isotretinoin includes craniofacial malformation, cardiac, thymic, and central nervous abnormalities, but the commonest are microtia, anosia, micrognathia, aortic arch or heart defects, thymic ectopia or aplasia, or cerebellar vermis agenesis. So these malformations can be explained by the massive cell death that occurs in vertebrates during neural development and due to the fact that apoptosis is a contributor to nervous system development that requires a proper apoptotic signaling during embryogenesis. So ATRA is responsible for inducing reprogramming of cranial neural crest gene expression with the increased apoptosis secondly. So studies conducted on animals have confirmed that isotretinoin administration during pregnancy can increase the apoptosis of neural crest cells and the appearance of malformations. So malformations are caused by excessive cell death limited to trigeminal ganglion neuroblast during ganglion formation. So these are proposed by studies on mice which concluded that increased cell apoptosis is the principal mechanism involved in craniofacial malformation induced by isotretinoin administration. So next slide, please. So for the possible treatments and interventions, tip 1, stop taking high-dose vitamin A supplements such as isotretinoin. Tip 2, prescribing physicians should ensure that women of reproductive age who take isotretinoin understands the fetal risk of these drugs and use effective contraception. While tip 3, preventing fatal exposure to isotretinoin will require system-level interventions in addition to those at the level of individual healthcare providers and patients. So next slide, please. So these are the references used in this reporting. So that would be all, Doc. Good evening and thank you.